the next couple sheets are on warning signs. That's what suicide potentiality indicators means. And as I'm sure you notice, a lot of the emotional stuff is the same as what is for people that are in crisis. And so it's really kind of hard, you know. On one hand, I'm saying, well, these are the feelings of people in crisis, and they're the same things for the people that are oftentimes suicidal. And so, again, one of the ways you're going to start figuring out where that line is you need to ask questions. We never set ourselves up as psychics, you know, in the sense of thinking that we should be able to know without doing a lot more direct questioning. But when people start, some of the behavioral clues are changes in appetite and sleep, poor impulse control. Like, say, if somebody starts talking about, I'm going to go run up my credit cards because, heck, it doesn't really matter because I'm not really going to be here. I'm out there having unprotected sex. You know, I started shooting up a lot more drugs. You know, those are the types of things that would be like, okay, red flag. Especially if this is not one of the typical behaviors. Putting their affairs in order. Now, again, that's a great, wonderful thing to do. But if they're really obsessive about it and out of the blue talking about it, even though they may be otherwise healthy and not anywhere near dying, that's something to pay attention to. And giving away their possessions. People sometimes will even say things, you know, like, I just want to make sure that my cat's going to be okay. And so, you know, if people start mentioning those types of things, those are all red flags.
And could I also say that for some of these in emotional behavior, these are common symptoms of brain injury also. And it makes it a little bit more difficult as you're doing assessments, which I think probably leads you to want to be able to ask clearer questions about what does that mean. So poor impulse control is often a symptom of brain injury, and so maybe that would be a good question: is this something that's normal for you, or
Right. And again, that is part of the hard thing, is that because a lot of these are actual ongoing symptoms that people have. And so you have to find out, in a sense, what their baseline is, which means, is this a deviation from how they are now and what they're doing? But, for instance, with sleep, anybody who's ever worked graveyard or raised children, you know, I mean, being up enough at night where you're not sleeping is enough to send anybody over the edge. You know, so there are things to pay attention to that can really affect the person's functional status. The things that people tend to think about are, you know, they just want to get out of here, which is that escape thing, feeling that their loved ones will be better off without them, wanting revenge. Now, again, you know, depending on what the situation is, I mean, people want revenge in all kinds of ways, but I have heard literally and talked to over thousands and thousands of suicidal people. And I would say, I think that the movies, for instance, we see a lot about this at times, about revengeful suicides. I'm going to get them, and that is, I would say that that's way down on the ladder as to what people's motives are. I would say I actually hear a lot more about they'd be better off without me. I hear a lot more people saying, you know, they feel like they're a burden to people than any of that revenge stuff. Wanting control over how and when their death might occur, because sometimes they feel like, I don't have any control over anything else. It's almost like everybody has to have their exit strategy. It's like when you do have a terminal illness and you're deciding how you're, but for some people in their life, it's like, this is the one thing that I get to control. And then just wanting to end, you know, an unresolvable conflict. I mean, that can be everything from, you know, situations where people are fighting over custody of their kids, or money issues, all kinds of stuff. And then the negative triad of bad self, bad world, bad future. You know, they really cannot see anything but that. One of the metaphors I like to use for suicidal people is that it's like a horse running down a track with blinders on. And as time goes on, that they become even smaller and smaller, to the point where it's like right out here, suicide becomes the thing that they can see. This is the one answer that I have been able to find. And part of what happens in suicide intervention is that we help remind people that outside that little size thing that they're seeing, which has suicide, there are possibly other options that can work and help. But usually it becomes, they're in so much pain, it's almost like, if you think about it, if you're in pain, if I could take this pill, it will make everything okay. And that's what suicide becomes too. It's like this becomes the one answer that that starts to, kind of become predominant in their perceptions. And the number one precursor for suicide is loss. And of course, your folks are dealing with tremendous losses. And sometimes it's not just the brain injury. It can be all of these other things that are listed here. Loss of relationship, loss of money, financial problems, loss of job. So it can be like a tidal wave of loss that hits people. And it takes quite a bit to help people recover from things like that. The chart that's on the back is very similar, so I'm not going to go over it. I'm going to go over the CPR part, which is intervention with a suicidal person. So as we've mentioned, so if you're talking to someone who's suicidal, or you believe may be suicidal, never hesitate to ask the questions. Much better to err on the side of caution than to not ask the questions. I have never seen people get offended if you inquire about whether or not they're suicidal. People are touched that you're actually paying that much attention and that you care. And so say you're in a situation where you're hearing a lot of these things, and again, believe me, I know that your situation is very complicated, and so some of them may look and sound like someone may be suicidal when indeed they're not, because they're having a lot of those feelings, they're having a lot of the situational things happen, etc. But you can always couch it with, I've heard that, so they've been talking about their brain injury. And then they say, and now my girlfriend and I are breaking